Good morning, everyone. Thank you so much for joining us this morning on Emory Healthcare's series with DeKalb County School District for our monthly health and wellness presentations for the school district employees. We are excited to be with you all this morning and have a really great informative presentation on the topic of sugar shockers and healthy eating and nutrition information. And we are very thankful this morning to have our wonderful Dr. Victoria Green with us. Dr. Green is a OBGYN by practice. She has more than 35 years of experience in women's health and provides gynecological services as well as well woman exams and family planning. She has her MD from Northwestern University. She also did her internship and residency at Henry Ford Hospital in Detroit, Michigan. She has both a JD and an MBA from Georgia State, as well as a Master's of Health Science Administration from the University of Michigan. She wears several hats here at Emory Healthcare, and Grady Health System as well. So we are super excited to have her here with us this morning, and I am going to pass it off to her to get us started.
Thank you so much, Ms. Rulin, and thank you also to all of the participants. I truly appreciate the opportunity to speak with you. I want to thank Ms. Rulin for this opportunity, as well as the DeKalb County Health Department. Really looking forward to this presentation that we'll have with regards to sugar shockers, talking about just some interesting facts about sugar shockers. Although I'm an OBGYN, it is a topic that truly surpasses not just women, the children, the men, everyone will be involved with this. So really what we'll discuss are some of the interesting facts about sugar. As you can see with regards to healthy eating, our foods contain three types of nutrients. So carbohydrates, preferably the healthy carbohydrates, as well as proteins and fat. But the carbohydrates are the ones that provide that main source of energy. As you can see here, when we eat, foods turn into glucose, and that glucose is then transferred into energy. Unfortunately, with diabetes and other conditions, there may be some difficulty in making that happen appropriately. So we do need those carbohydrates for energy, but as you can see, carbohydrates are much more than just the sweets and the sugars, the cakes, pies, candies, cookies that we all so much enjoy, but also the starches and grains. So the breads, the pastas, the macaroni and cheese, the spaghetti, rice is also a part of the starches and grain. Fruits and fruit juices, because the fruits have naturally occurring carbohydrate, and so that is still a part of the carbohydrate group, especially our starchy fruits such as our apples and bananas in many cases. Milk and yogurt is part of carbohydrate, as well as your starchy vegetables. Those can include your corns, your peas. Even though it is a green vegetable, it is still a starchy vegetables. But there are healthy carbohydrate choices, and I know you know many of them, and I'd like you to go to that poll everywhere, and we'll take a look at what your options might be with regards to what do you think are some of those healthy choices for carbohydrates. All you have to do is type that in. I think it's already activated, and we can see that response when you type it in. And up at the top, if you haven't had an opportunity, you can see other ways to join here.
And I will drop that information in the chat as well for folks.
Yes, some of the good, that's right, bananas, definitely. Anyone else? I know someone has other thoughts about it. Yes, avocados is one of the healthy, a lot of oil in avocados, but it's one of the healthier oils. You're exactly right. Anyone else have any other suggestions? I think those are two good ones. I'll go back now to the presentation. Oops. Here we go. So you all are exactly right with regards to those healthy carbohydrates choices. We have our fruits, our whole fruits, just as you mentioned, our oats and barleys, grains, cereals, and pastas. Brown rice. Brown rice is primarily because of the processing. My children will say because there's soy sauce on processed Chinese food rice, that is brown rice, but that's not brown rice. It has to do with the processing. Beans, peas, corns, and potatoes, even though those are starchy vegetables, those are still healthy carbohydrate choices. I mentioned the whole fruits. I mentioned whole fruits in the sense that some of those smoothies that we have, although they may be whole fruits, oftentimes it's more fruit than we would normally eat. So you will put in your apple, your orange, your kiwi, and several others, but normally you would not be able to eat that volume. So even though it's healthy for you, the volume of it just may be more than what you would have eaten. So you're getting more calories than what you would have eaten if you had eaten the whole fruit. And then of course our low fat and fat-free milks and yogurts. But that's really just the tip of the iceberg, because we know that overall, average Americans are going to eat about 100 pounds of sugar a year. 100 pounds. That's probably half of our weight or a quarter of our weight. That equals about 26 teaspoons a day. And just to give you an idea, this is a teaspoon, and we're not talking 1, 2, 3, 4, 5, 6, 7, 26 teaspoons per day. So it's really a significant amount. And if you just try to put that in terms that others will understand and can relate to, if you have a 20-ounce soda and you just drink the 20-ounce soda per day, that's going to place about 26 pounds of body fat on you within a year. And in order to burn that 26-ounce soda, you're looking at moderate walking for about 1 hour. So it is a significant burden. So what difference does that make? How does excess sugar affect health? Again, I'm going to stop sharing here and go back to the other one so that we can look and see what do you think are some of the ways in which excess health impacts us. So let me clear those responses and still activate. If anybody wants to add, so how does excess sugar affect our health? What difference does it make if we eat that significant amount of sugar?
And I had dropped in the chat as well for folks, so you can either go to pollev.com/VictoriaGree193 or send a text message as well.
You're exactly right. Fat, everyone, you all, I don't need to give this lecture. You guys are already up to date on all of this information. Excess fat. What else? Any health consequences, long-term especially? Tired. Inflammation, you're exactly right. Diabetes, you all have this. As I say, I don't need to do this at all. You already know. Elevation of the A1C, and diabetes is that constant inflammation. And that's why it impacts our entire system, from the brain, the knees, the bones, and other aspects. You all have this. So stop sharing this and go back to the presentation. You're exactly right. Increased calories, weight gain, and that weight gain, of course, can lead to obesity. And there's a strong leap from research that indicates that there's increased risk of diabetes, fatty liver disease, as well as heart disease, and also dental disease with cavities can be a significant impact as well on that as well. This obesity is really an epidemic within not only the United States, but within the world. About 50% of US women will have obesity, and that's associated with 300,000 deaths per year. And although women are often concerned with regards to breast cancer, and even men with regards to prostate cancer, this is more than 3 times the deaths combined of breast and prostate cancer. And what I'm going to go through is data from the CDC. You can see that this is beginning in 1985. And you can see here, for those of you who are geographically challenged, this is Georgia here. And what I'm going to show you is that Georgia is going to move from a blue state to a red state, and that's not a political statement. You can see here as a blue state that in 1985, we had about 10 to 14% of the population, which was obese amongst our adults. And you can see as we go along and move through the years that Georgia is going to move from a blue state and increase the number of individuals. Here we now have a new category of 15 to 19% of adults greater than the greater rate of obesity. And moving on through the years, of course, we now have a category in yellow of greater than 20%. And as we move through the years, again, we've added another red category, greater than 25% of the population that is obese. And then greater than 30% in 2006 that we had to add that category. And as you can see, what happens in government is as soon as everything is wonderful, the government changes everything. And so they move to a different coloring category. It's still the same. And you can see Georgia here, still about 25 to 30%, but they didn't have enough red categories in order to move to a 40. And now we have a 50% category. But again, you'll see from 2011 that Georgia is then continuing to move 2012 from the 30% to now 35%. And as of 2021, which is the last data that we have about 35% of the population in Georgia that is obese. So 1 in 3 individuals is obese. So significant public health problem. But we know that there are social determinants that are associated with that. It's not necessarily just what anyone eats, which are the behaviors that we have here. Many will believe that it's biology, but note that that's only about 5% where one can say that, well, my family is healthy or I have big bones, and so that's why I have that problem, because that's only about 5%. And only about 20% clinical care as well. The majority might be in social economic factors, such as possibly not having income to have access to individuals or doctors, or access or education in order to understand information or public health messages. What is the social or built environment? Do you have access to walking or the ability to move around? Or even with in your home, if there are multiple individuals, you may not have the ability to even exercise or have a place where you can move, that you can exercise or move around. We also have a cycle of environmental health disparities as well, where there is problems with infrastructure, especially in older houses. You also have lead. You may live by a highway or a dumping facility where there are toxins, significant stress, which lead to health problems as well, violence and crime, and all of that impacts the problems that we have with regards to obesity as well. We know from Dr. Martin Luther King that of all the forms of inequality, injustice in healthcare is the most shocking and humane. And so I appreciate the opportunity for us to help ourselves as well as to help others around us. With those social determinants, everyone's familiar with equality, where we provide everyone with equal things or equal access, but that's not very helpful to allow that person to be successful in seeing the baseball field. But if we provide them equitable access, again, providing them what they need, that is really what we're trying to do as far as improving access to healthcare. Similarly, here, equality is providing everyone with the same bike, but you can see that's not very helpful to the short individual as well as the taller individual, as well as those who may not be able to access that bike. But if we provide them the appropriate bike, that's what we consider with regards to equity. We also know the reality of the situation is that some actually start much lower and some are actually advanced from the very beginning. So even the reality is much more than equality and equity. Fair isn't everybody getting the same thing, but fair is everybody getting what they need in order to be successful. So when we're talking about that, how does this matter? How does the obesity, how does the weight matter? How does that impact? Sugar shocker. And that's because we know the physical effects of obesity impact your respiratory system, gallbladder, hormonal issues, but importantly, your stroke and cardiovascular system. Diabetes is really connected to that as well. Osteoarthritis, as that weight impacts the knees and the knee's ability or the back's ability to really support that amount of weight, as well as cancer. We don't think about it, but it does increase the risk of certain cancers, as I'll show you that in just a second. As we can see here, even maternal mortality. Unfortunately, Georgia ranks last with regards to maternal mortality or worse. You can see that that's about 17.4 deaths per 100,000 live births, according to CDC data. But unfortunately, for every 13 white women, there are 44 Black women who died from childbirth-related causes. And some are like me, I'm a more visual person. I can see it better this way, that if you look at deaths from pregnancy-related causes, you can see that Black non-Hispanic women die much more than white as well as Hispanic women. And unfortunately, 2/3 of those, according to Georgia data, are preventable. 2/3 of mothers who die, it is preventable. And I just want to show you some of the Georgia data that shows that diabetes or problems with sugar is an important component of what women present to pregnancy with, as well as hypertension, and obesity is in this other category. I also want to look at our children and adolescents, because many of you all are caring for or educating not only adults, but children. And we see that about 12% of our toddlers are obese, about 20% of our 6 to 11-year-olds, and about 18% of those 12 to 19. So it's not just adults who are in that obese category. And I appreciate what you provide as educators. I just applaud you for all that you do. If individuals are educated, you can see that about 30% of them will have no physical activity, which means that 70% will have physical activity. But if they have less than a high school education, nearly half of them will have no physical activity, and that's increasing that risk of diabetes, obesity, and hypertension. I mentioned earlier, obesity and inactivity raises cancer risk. You can see those numbers as they increase over time. And specifically focusing on breast cancer, you can see that about 15 to 20%, and this is the US here, about 15 to 20% of cancers, postmenopausal breast cancers, are attributable to excess body weight. Also, if you look at risk factors for heart disease, you can see being overweight and physically inactive. We know that the brain and the heart are really closely related. So even with regards to Alzheimer's disease and related dementia, you can see lack of physical activity, obesity, diabetes, and that sugar shocker, hypertension are all risk factors. Even the coronavirus, obesity is one of the risk factors that we've seen. And I just want to show you some of the charts with regards to the risk in certain populations. If you look at heart disease, you can see that Blacks have a higher risk of heart disease, although we do see it in people of color as well, in our Hispanics, and not too far away from whites, and much less for Asian Americans. If you look at the prevalence of diabetes and all of, I hate to say, all the other chronic risk conditions, you can see they're always greater in the South. Here in Georgia as well, if you look at diabetes, greatest in Blacks and highest in people of color and with Hispanics. And again, about double that what we see in white as well as Asian individuals. Cardiovascular disease, again, greatest in the South, greatest amongst African Americans, which is this red bar here as compared to other ethnicities. If you look at white females as compared to Black females, this is white females here with regards to coronary heart disease, and you can see that Black females here are greater with regards to heart disease, stroke, as well as breast cancer risk. Focusing again on heart disease and the impact of sugar on the heart as well, you can see Black Americans have a greater risk, and it's almost double that of Hispanic and Asian individuals. With regards to hypertension, again, Blacks, greatest risk. And those as far as hypertension deaths, greatest amongst African Americans, and preventable and avoidable deaths overall, greatest amongst African Americans. And I always have to throw in the OBGYN component of it, even though that's not what we're talking about today. Preterm birth rate, greatest amongst Black individuals. Infant mortality, worse in the South, and again, greatest amongst African Americans. As a matter of fact, in 2012, nearly 7 babies died for every 1,000 live birth, and that was actually an improvement, which is really, really sad. African Americans are more likely to die at any age from all causes. And again, you have your diabetes, your stroke, as well as your high blood pressure. And I always go back to the 30% of breast cancers that may be preventable by simple changes in lifestyle. And it's not just, large conditions or those with significant morbidity. Even menopause and irregular cycles have significant impact with sugars and weight. And it's not the seven dwarfs of menopause. It's not the itchy, bitchy, sweaty, sleepy, bloated, forgetful, and all dried up. Not those. But if you look at men and women, men kind of just have that on-off switch, but women are really much more complicated. A lot of things that go on with regards to women. But if you're trying to cope with some of the symptoms from menopause, you can see again, exercise and healthy eating. So everything that we do, everything that we're trying to solve, a lot of the issues that go on with regards to our communities and our health have to do with healthy diet, weight control, regular exercise. These are the life's simple 7 modifiable risk factors across the life core. Reduce your risk of diabetes, which means improving your information and your knowledge of the shocking amount of sugar, as well as no smoking, blood pressure control, and lipid control. So overall, this simply means that we need to eat healthy. We need to eat the colors of the rainbow when it comes to our healthy food, and we need to focus on how to build our plates, how to be healthy, which means that fruits and vegetables account for 1/2 of your plate, whole grains about another quarter, and then your food size is really it's just your fist. Your meat portion should be no bigger than your fist. And we know even a chicken breast is bigger than your fist. So we shouldn't be eating anything other than a portion that's about the size of your fist. We also want to do those preventive things that can help us prevent problems with sugar, and that is such thing as breastfeeding, which unfortunately is natural for children. They're just used to this as one of the healthiest things that we have to feed our children. Your breast milk contains 3 million germ-killing cells per teaspoon. Your breast milk is that awesome. According to our Surgeon Generals in their report on the blueprint for breastfeeding, one of the most highly effective preventive measures a mother can take to protect the health of her infant and herself is breastfeeding. As a matter of fact, according to the CDC podcast, childhood obesity prevention begins with breastfeeding. And this is older data, but if you look at the risk reduction on breastfeeding children, you can see it reduces the risk of obesity in the child and in the mother. It reduces the risk of diabetes type 1 and type 2, as well as other things with regards to otitis, dermatitis, and respiratory infection. Also note from a maternal risk reduction, it reduces the risk of premenopausal breast cancer or ovarian cancer, as well as some of the cardiac risks such as aortic calcifications and coronary calcifications. Cost analysis, again, from the CDC shows that if we optimally breastfed, then we would be able to reduce nearly 5,000 cases of breast cancer, 54,000 cases of high blood pressure, 13,000 cases of heart attacks, and that would account for about $17 billion in savings from premature death. So when we're looking for more money into the DeKalb County District system, this is one way that we can help that. Also focusing on the pediatric aspect, you can see that we would save 911 childhood deaths and 14 billion from pediatric disease. But in those that can best benefit from breastfeeding, you can see that they are the lowest, such as African American women who have the lowest rate of infants who are breastfed. So I know this is a lot of information, and one of the things that you're just saying is, this is great. I'm going to teach my students. We're going to really work on this sugar information. But we know that based on their ages, their information, as well as the nutritional plans for their age, we have to teach them differently. So kids' nutrition might be different with how the plate is shown. We know that our older children, or slightly those older age, what they need might be much different. Our athletes, we need to teach them because they think that whatever they eat or whatever they do is satisfactory, and that may not be the case. We need to teach them how to make healthy options and healthy choices. As we grow older, what is that information for us, and what can we do in order to improve that, as well as in our senior arena, where we may need more calcium intake, and how male information may be different from females. But as you all know, the education system, we cannot teach everyone the same. As it says here, for a fair selection, everybody has to take the same exam. Please climb the tree. Although each of these animals are experts in their particular field, they're not experts in climbing the tree. Everybody is a genius, but if you judge a fish by its ability to climb a tree, it will live its whole life believing that it's stupid, rather than providing that individual the information that they need in order to make the best choices for themselves. So what we're going to talk about is providing that information through the continuation of an individual's growth from childhood to adulthood, and then through our senior years. We know that our children, if they're exposed to significant sugar intake, that is what their taste buds will enjoy as they grow. Not as much trouble here, but as they grow, their bodies will not be able to handle that sugar content. I showed you the data that was 12% of our toddlers actually have obesity, and that increases as we go along here throughout the continuum of life. We know that this is important because 90% of child's brain development happens before age 5, and if that inflammation associated with that excess sugar is impacting the child's brain through this development, this is not a good situation for that child. I haven't also included that with regards to pregnancy and pregnancy complications. We know that women who have gestational diabetes through their pregnancy, we notice that the children also have increased risk of problems with sugar, as well as women who have high blood pressure during the pregnancy. They may have problems with cardiovascular disease later in life, not just during the pregnancy, but later in life. This may indicate an increased risk for them. So as we continue, we know that the amount of sugar that's needed in earlier life is different from the amount of sugar and nutrients that we may need later in life. And what we also want to say is, as we are educating, notice that it's not just the children that need the information. It's their parents that we need to talk to, student athletes, and I'll show you some information specifically on them, our colleagues, as well as possibly your church family. We need to extend this. Your civic organizations, your neighborhood, your Delta Sigma Theta or other Greek organizations. What about your family? And it's not just your aunts, your uncles, your sisters, your mother, your father, it's also the children. One of the things that I've heard from some of my patients is that they have diabetes, they have one meal for themselves, but when the grandkids are over, they make a different meal for the grandkids. But if grandma has diabetes, the rest of the family is at increased risk. So if they can feed the grandkids the same meal that they are eating for their diabetes, that will allow their taste buds to then enjoy that meal at a later time when they have to have that type of meal. So it's no need of having separate meals. And we also have to remember we need to teach ourselves as well. So I'm going to go back to what we were going to talk about overall, and that's the shocking information that we have with regards to the amount of sugar in many meals. If you look at what we feed our children, you can see it's almost like eating a bowl of sugar with regards to the Fruit Loops, the sodas, the ice cream, the sugars. And what I want to talk to you about are, what do you think are some of the most common sources of sugar that we have? What do you think common sources of sugar? And I'm going to go back to our other screen. Oh, I seem to have lost it on my screen.
We could also have, if you'd like, if folks want to drop maybe their answers in the chat as well. So somebody just chatted soda.
There you go. That's perfect. That will do it because it can't seem to.
Yeah, so if you all want to drop your responses in the chat. Someone else just said candy.
Perfect. Thank you so much, Lindsay. I appreciate that.
Of course. Fruit juice,
That's it.
ketchup, almost somebody else said almost everything.
I love it. I love it. That's exactly right. So going now through those, let me see, common sources. Let's see if I can keep going here. soda and pop, depending on how you say that, your energy drinks, flavored milk, fruit and flavored drinks, especially those that are not 100% fruit juices, iced tea, lemonade, and your sports drink. Just to give you an example here, if we look at this soda here, or pop as you might say it, how much, you can put that in the chat as well. How many grams of sugar do you think is in this 8 ounce? And just to give you an idea, there are 4 grams of sugar for every teaspoon. So what do you think? What do you think? How many grams of sugar? Lindsay, you'll have to tell me what they're saying because I can't see the chat.
Okay, I will keep an eye out.
How many grams of sugar? If you count the teaspoon, 4 grams of sugar per teaspoon. There you go, 28.
28, yeah.
28 grams of sugar in this small soda. But we all know that we never drink a soda such as that. And especially when we upsize it at some of the fast food places. It actually, if you look at a 44 ounce, which is generally the upside from the fast food, you can see 128 grams of sugar generally in your sodas. What about energy drinks? And this is what that we see a lot in our high school students. How many grams of sugar do you think that we have in our energy drinks? Do you think it's higher or lower than what we had in that the small soda? Higher or lower? Some say higher, some say higher, some say, you're exactly right. 54 grams of sugar in an energy drink. 54 grams of sugar. It's about half of the upsized soda that you might have. What about your sports drinks? So this is our athletes who swear by the sports drinks and think that they're most appropriate. What do you think? Higher or lower than the energy drinks? Higher or lower than the energy drink? Some say higher. Anybody else? Higher or lower than the energy drink? That's true. Get the zero sugar one, and that is actually better. You're right. This is actually about 35 grams of sugar. But again, we know that they normally don't drink just one. So it's 35 grams, but more, they're usually probably getting more than one, even at one event or one exercise or one workout event. What about your bottled smoothie? Not the ones that you make at home, but the ones that come in the little plastic bottles, about 15 ounces. Do you think that that's higher or lower again than the energy drink? Higher, some say. Let's see. Anybody else? Higher or lower than the energy drinks? Some think about the same, some think lower. The bottled smoothie is about 60 grams of sugar. Now that's the bottled. As I mentioned, the ones that you make, and they're all natural sugars, they still have a lot of sugar, even though it's a fruit that you make. And as I say, the calories are often higher because it's more fruit than you would have eaten if you had just eaten the whole piece of fruit. So 60 grams in those bottled drinks. So how do we get around this? Well, of course, we need to read the labels. And this is the current label of information. You can see it's a little more difficult, but our newer labels coming out are you're going to be easily able to see the number of calories. It's important to look at the serving size, which is only 2 bars, even though there are 10 bars in this particular package. So it's 190 calories per 2 bars. And specifically, you can see the carbohydrates. This particular item does have some additional nutritional value in the fiber that is there, but you can see that there are a lot of sugars, and most of those sugars are added sugars. That means that they have no essential nutritional value. They're really just added sometimes for preservation, sometimes for taste, and sometimes just for the texture. We also have to be careful about looking at the ingredients. It's not always just sugar. Honey is also in the source, brown sugar syrup, and I've added in the slides also some of the sugar aliases, as we call them, honey, fructose, lactose, molasses, corn syrup. It's not just the high fructose corn syrup that everyone is talking about now, but there are other things that we can see, including fruit juice concentrates. For example, axle juice concentrate is another word simply for sugar. And those added sugars are sometimes very interesting in the sense that they are not those that you often consider as something that is sweet. But even your condiments, such as your ketchup and barbecue sauce and your salad dressings, ketchup actually has about 4 grams of sugar in a teaspoon, and those little packets are only about a half of a tablespoon. And so we know that we put multiple packets often on your French fries or your hamburger or whatever it might be. And as I said, salad dressing is another one. Granola bars have about 8 grams of sugar within them and about 130 calories. About 18 carbohydrates within the granola bars. Meal replacement, pasta sauces. So be careful with regards to the low fat or fat-free types of items, because that actually can be added sugars that they use in order to make up for that taste. Now, this I haven't had a chance to verify, so please, but it is in the Atlanta Journal-Constitution. I also think that we need to be cognizant of what people are reading, even though it may not be within the medical literature. 9 healthy sounding foods that have more sugar than a Krispy Kreme donut. So again, if you can put it in the chat, what do you think of those 9 healthy sounding foods that may have more sugar than a Krispy Kreme donut? And I'll answer that while I'm saying it. Is Crystal Light okay? I see that. Crystal Light is one of the better things, one of the things that you can do. It doesn't have to be the full packet. So even when you put it in the water, you can just put it in the water just to taste, not the full packet, which means that you can use that same packet for 4 or 5 bottles of water rather than putting the entire packet. It still has some sugar in it. You know, it is, I think that's the Splenda that it has within it, and it also has some added sugars to taste. So it is better than some of the others, but everything in moderation is essentially the conversation that we have. You're right. Bagels, granola bars, energy bars, exactly. So let me just show you this from the Atlanta Journal-Constitution so you'll know what your parents, what your children are reading. Here are some foods and drinks that have more sugar than a Krispy Kreme donut. That bottled Naked Juice green green machine smoothie, about 55 grams of sugar. A Krispy Kreme donut has about 10 grams of sugar. So that's about 5 Krispy Kreme donuts. 1/4 of a cup of sun-made raisins, about 30 grams. So that's about 3 Krispy Kreme donuts. The Greek yogurt, 15 grams, about 1.5 Krispy Kreme donuts. Granola bar, 11 grams, equal to about 1 Krispy Kreme donut. Vitamin water can have up to 32 grams of sugar. A cup of Mott's applesauce, 22 grams, 2 Krispy Kreme donuts. The Mango Protein Soy Protein Shake, 47 grams. And then Quaker oatmeal with the apple cinnamon, 12 grams. So 2 Krispy Kreme donuts. And your Nesquik low-fat milk. One of the things that parents often do is to give the chocolate milk just to try to get the child to drink milk. But again, note that that's 22 grams or 2 Krispy Kreme donuts. So not as healthy as one would think. So what we're saying overall is just that we need to eat healthy. We need to eat a variety and moderation. I'm not saying no to anything. I'm saying everything in moderation, and think about the things that you eat, noting that some of the things that we believe to be healthy are not necessarily as healthy as we believe them to be. So eating healthy, getting regular exercises, losing weight, if anything, and stress management as well. If you're having a lot of stress, we often stress eat. You stress, don't exercise sometimes when you're stressed. And so making sure that we're managing stress as much as we can and focusing on the portions on your plate. As you can see here, that half of vegetables is really important. Beware of portion distortion. 20 years ago, when you went into the restaurant, this is what you received, about 500 calories, 1 cup of spaghetti and 3 meatballs. Well, today we continue with the 3 meatballs because you know that the restaurants are not going to give you more meat, but they will give you more cups of spaghetti. And now it's up to 1,200 or 1,000 calories, as you can see here. So beware of portion distortions. And one of the ways to help with decreasing the volume of food that you eat is really just to put it on a smaller plate. It really makes you believe that you have more than is actually there. So instead of using a dinner plate, use an appetizer plate or a salad plate, and that will make you think that you have more than actually you do. 100 calories extra per day, which could simply be a cup of orange juice, can actually gain 10 pounds of weight per year. So just be careful about that extra portion. So what are some of the things that we can do? Practice one new behavior faithfully. And we know that new behaviors take about 1 month to become a habit. And if you first don't succeed, try again. Try all the time. Nothing beats a failure but a try. And most importantly, believe in yourself. If you think you can, you can. Believe in your students. If you think you can, they can. Believe in your family members as you're trying to educate them with regards to this information. And just do it over and over again, because new behaviors can take up to 1 month. So we have to continue to reiterate this over and over again. Importantly, life is not important except in the impact it has on others' life. And as all of you know, as educators, again, I applaud you for all that you do and the impact that you have on lives on a daily basis. And thank you so much for all that you do for the children and the adults of the world. So I thank you for your attention, and I'll be happy to answer any questions that you might have.
Thank you so much, Dr. Green. I know we just had a few, I think a comment question in response to that AJC article list. Somebody had asked, is it best to have plain or vanilla Chobani yogurt and add fruit?
The note that, as I said, everything in moderation. So when you're adding the vanilla, that's a sugar source. When you're adding the fruit, that's a sugar source. So plain is, of course, the lowest sugar content, but it may be that you're not getting sugar in anything else that you're necessarily eating. So everything in moderation, but just realizing that each thing that you add to the yogurt, including the yogurt by itself, does have a sugar content in it. So looking at the other things that you're eating in that day and looking at your total sugar source for the day, total calorie source, total carbohydrate, depending on your risk for diabetes for the day. And maybe we shouldn't add the fruit this time, or maybe we should add a low sugar fruit this time.
And so I am now also going to go through and allow everyone to unmute themselves if they'd like to ask a question that way as well. So you all will see notification in a second. And just, I know folks tend to ask this at the end. So this recording will be shared out afterwards, as well as the slide deck. And once we are done recording, I will share with you all how that will be done. So I'm going to allow everyone to talk if you'd like to. You can ask questions that way. Again, feel free to use the chat and the Q&A function as well.
I can see a question here. Do weight loss drugs like Wegovy help with removing challenges with obesity long term? Again, you know, as everything, every medication has its side effects, as all of you all might know, significant problems with regards to diabetes, and also significant problems sometimes when it's not added to weight loss changes in the diet. Sometimes people depend totally on the medication rather than the recommendation of adding to both. It's not necessarily necessary. It's not necessarily necessary to use medication, but in many cases, and that's a conversation with your physician when you've tried other opportunities, because they're going to recommend trying on your own, cutting back in small areas. Many cases, we try to do too much at one time. We're 100 pounds overweight and we're trying to lose all 100 pounds in the first month. So sometimes, as I mentioned before in the slide, is just try one healthy behavior, one new behavior. Start with that. So in other words, I'm just going to look at my breakfast meal, or I'm just going to look at my lunch meal every day. And instead of the 5 tablespoons or 10 tablespoons of salad dressing, I'm just going to cut that in half. Or I'm going to go to a different type of dressing. Instead of the Thousand Islands, we're going to go to vinaigrette or something such as that. So one healthy behavior each time. Maybe that healthy behavior is I'm just going to walk 20 minutes a day. It doesn't have to be outside. You can be in school. You can walk up and down the steps instead of using the elevator. If you work on the 11th floor, walk up to the 3rd floor and then take the elevator from the 3rd to the 11th floor. If you're parking in a garage that has a slant to it, again, walk down 2 flights and then take the elevator down the rest of the flight. You can always add these little things. So just try one healthy behavior. So does it help with removing the challenges? It does decrease the desire or the appetite sometimes. So that helps with that. But is it 100% necessary? No. And is it the first choice? No. But is it often necessary based on long-term trying without success, especially when there's potential for heart disease, diabetes, the inflammation that is associated with that, and the long-term impact of that on the heart? Then your provider might say, yes, this is a better option for us at this time.
Well, I don't see anything else in the chat, but again, everyone, you can feel free to unmute yourselves if you have a question and would like to ask out loud. And we will give folks another minute or two. See if anyone has any questions before we wrap it up.
Okay, I do have a question.
Yeah.
My question is about, she said to like it was about the additives that you add to like their water, like what is it called?
Crystalline.
Yes, like Crystal Light. Okay, so you were saying to use half a packet of one of those in just in a regular bottle, right? Like a 16.9 ounce water bottle. Okay,
Yeah,
and
see,
go ahead.
anything that you add to your water, best is just to drink water. That's the best overall. If I don't say anything, best is just to drink water. No calories, no additives, no anything. Good support even during exercise. It doesn't have some of the electrolytes, but we can get those in other ways. So water is your best tool. So we sometimes don't like water over time, but the better thing is really just to drink plain water. If you will not drink plain water, you have to add something to it. Then honestly, a lime or a lemon or some sort of fruit that you just put in the water, that you can have a big bottle of water, have that in your water all day, is actually more natural than adding even a Crystal Light. But when you think of Kool-Aid as compared to Crystal Light, yes, Crystal Light is going to be better. Everything in moderation, though. The reason that Kool-Aid tastes better is because it has more sugar to it. There is still some sugar in Crystal Light and Mio and all those other things that we add to the water. So again, everything in moderation. But one of the ways to cut back on the use of Crystal Light, which again, our goal is plain water. One of the ways to cut back, because they ask you to put that one packet in one 16-ounce bottle, is to then cut back on the amount that you're putting into the bottle and just drink to taste. All you want is just a little sweetness. You really don't have to have as much sweetness as the entire packet. And over time, what you'll notice is that you need less and less of that. And again, using, say, the lemons, the limes, and things like that really to taste the water rather than the packets, and save some money as well.
Looks like
If you typically wake up with high numbers, is there anything that you can eat at night to help that? I'm assuming with regards to diabetes, and I'm not sure if person is on insulin or not. Sometimes it's indicative of the need for increased insulin overnight, or it's indicative of too much at dinner time if you're waking up with that. So looking at your carbohydrate intake, it depends on what your provider has told you. Sometimes it's 35, 45, depending on male versus female. But if you're waking up with those numbers, sometimes it's indicative of dinner intake and then what you're seeing upon waking. The other things that sometimes doctors recommend, depending on when your activity for the day. Some people are more active after dinner. Some people do their exercise in the morning, and it may indicate the need for exercise, say, after dinner in order to lower those numbers. But again, I'm thinking in the realm of diabetes, and I may be wrong. I may be thinking something into that. So if I am wrong, just please speak up for me. And then the other thing, speaking of water, is spring water or purified water better than tap water? I hate to say it, it really depends on the person as far as having no sedatives or lead that's sometimes in the pipe of tap water. Then you might look at it in that direction. But when it really comes to healthiness over a long time, as long as there's no lead in the water and things of that sort, we might come out about the same. But if I speak to my environmental people, they're probably going to go with spring and purify. But again, long-term, it's probably not that significant amount of sedatives in that water to make a significant difference, not to make a difference, but to make a significant difference. But if you want to get the purified water that they just simply attach to your sink, that's probably a little cheaper than buying all the other different types of waters that are available. But again, long-term, it may not make a significant impact, but again, I'm not a purist. So if you speak to a purist, there are sedatives that are in the water that are being removed based on your purifier.
It looks like, double checking the chat to see if we have anything else. All right, well, if nobody else has any other questions or comments, we will go ahead and wrap it up. And there is one really great resource I wanted to share with you all just after we stop recording today. So if you want to hang on for 1 second, but just wanted to say thank you so much to Dr. Green for taking the time out of your schedule and sharing this really helpful information with everyone. I know it's information that, like you said, a lot of us probably know, but a reminder is always helpful, and more in-depth detail is always appreciated. So thank you again, everyone, for joining, and we look forward to seeing you all on our next talk.